Hi everybody, it's Dr. Beth Cook here. How's everybody doing today? Hope everybody's doing good. It is cold in Houston, which is rare for us. So it's like in the 30s outside, which means I need a parka and a coat. And a hat and gloves and all of those things. So today I'm going to talk about autoimmune disease. Before I start talking about that, I will remind you, if you catch the replay of this, nobody's on live yet, to share this video. Please share this video. Get this information out to as many people as you can. This is important stuff. And hi, Donna. And people need to know this information. They just do. The more patients I see, the more research I do, the more doctors that I talk to, the more and more conviction I have about what we do at the Wellness Way and how important it is for people to know this information, because they are sick and need help and have no idea what to do, and the only guidance they're getting is from their medical doctors, and that community is kind of clueless when it comes to some of these conditions. So please share this video, comment, if you have questions, ask questions, tag friends that you know that are suffering with autoimmune disease, so that they can get a different perspective, even if you don't think that they are inclined to do something non-medical. Then tag them, because they could have their eyes open to a different perspective, a different approach that is very important to their health. So hi Stacy, how are you? Thanks for joining us. Okay, so autoimmune disease is something that I've been seeing a lot more of lately, and been talking to people a lot and patients a lot more about, and it's becoming very prevalent. So it's on the rise, and there's not a whole lot of oh good, I'm so glad that you're getting some information from me. That's awesome. So share this video so that other people we can impact as well. So it's on the rise. More and more people are getting diagnosed with autoimmune disease, and like I said, the medical community is kind of clueless. They don't have a whole lot of options as far as treatment is concerned, or a plan of care that's going to help you get your health back if you've been diagnosed with an autoimmune disorder. We're getting sicker and sicker, younger and younger, and autoimmune disease is proof of that. These are not diseases that we're getting in the end stage of our life. This is not like when you turn 80, you get rheumatoid arthritis. You get it when you're young. The people are getting diagnosed younger and younger. Even kids get autoimmune diseases. Autoimmune diseases often come in pairs. So often when you are diagnosed with one, then typically you will have another condition pop up, or that diagnosis is coming, right? It's kind of on its way. So autoimmune disease is becoming more and more prevalent. And so it's important that we start to broaden our perspective on how we treat and how we approach these conditions. You see diagnosis when at 30. Yep, there you go. So usually they come in pairs. They never stand alone. And some people, like yourself, you had one and then you discover you have another. So I had a patient reach out, or somebody reach out to me the other day, and oh my gosh, she had so many conditions, poor thing. Just like one after the other. So I'm just gonna try to clear up some misconceptions. I'm not gonna talk about specific treatments, because everybody is different. If you know anything about watching these videos or about the Wellness Way, you know that my care is very unique to you. I have to figure out what's going on with you first before I can make any treatment recommendations. So autoimmune disease particularly affects women. Like 1 in 12 women will be diagnosed with an autoimmune disorder. There are so many kinds, like over 100. They can affect any part of your body. and it's because it's related to your immune system. So your immune system, doesn't necessarily discriminate. So there are lots and lots of different kinds of autoimmune conditions. And even though they affect different parts of your body, they are all kind of similar in how they happen. They can be very complex. Our immune system is very complex, so sometimes these conditions can be very complex. But my job at The Wellness Way is to help simplify as much as we can and figure out what's going on with you so that it doesn't have to be complicated. So I do have some notes down here if you see me look down. I'm just trying to stay on track here so that I don't squirrel off into different directions. So anyway, the biggest misconception, and if you've ever seen any of the other Wellness Way doctors chat about this, is that, the medical community will have you believe that your immune system is making mistakes, that it's attacking itself. That's what autoimmune disease is. It's your body attacking itself. But that's not true. So the way that our bodies were built and designed is that we are built to express health. So, if you were diagnosed with an autoimmune disease at the age of 30, like Stacy was, when she was 29, I'm sure she was experiencing symptoms before. But what happened along the way to make her immune system start affecting her digestive system? What happened there? And so the medical community will say that, in fact, I watched a quick little video, so I'm going to give you some tidbits that she shared. Some of them I agreed with, and a lot of them I didn't, but that it's it's an immune system dysregulation, that your immune system is being dysregulated, and they're not really sure why it's dysregulating. Well, if it's cold and flu season, right? If you get the flu or if you get a cough or a cold, is it normal to be like sneezing and coughing and all of these things on a regular basis? No, it's not. It's your immune system's response because it has encountered something foreign that it doesn't recognize or understand. So you have an immune response that your immune system is going to kick in and do its job. Your immune system's job is to protect you. That's its job. Is if it detects something foreign that's not supposed to be there, whether that is mold or a virus or an allergy, whatever that may be, our immune system's job is to protect us so that we can survive. So why is it any different in an autoimmune condition? It's not. Your immune system is simply recognizing something going on inside of your body, and it's trying to protect you. That's what's happening. It's doing its job. And that is resulting in chronic symptoms. That's resulting in you having pain all the time, or rashes, or joint pain, or digestive upset, or dry eyes and mouth, or some kind of neurological dysfunction. If it was a dysregulation of the immune system, if your immune system was attacking your normal cells, why all of a sudden is your immune system attacking your normal cells? Medicine will tell you it's your genes, that it's your genetics. Autoimmune disease does seem to be prevalent in families, but that is simply because you're predisposed, right? Once your body starts to get inflamed, then you're predisposed to express that certain condition. But, what happened to make all of a sudden your immune system think it needs to start attacking its cells? Well, what really is happening is that your cells are changing. Something inside of you is changing because of something you're doing or something that's going on in your environment. And that is why your immune system is responding, because those cells have started to change. Something inside of you has started to change. Like I said, it can be a complex process, so I'm trying to make this as simple as possible, but that immune system is trying to protect you. It's trying to do its job, okay? Okay, so if on the YouTube video, there was a doctor, and she's a rheumatologist, and she was talking about autoimmune disease, and she didn't have a whole lot of answers. So She talks about why there was an increase in the autoimmune disease diagnosis. And she said, because we're living longer. Well, 30-year-olds are getting autoimmune disease, not 80-year-olds. So if that was the reason, it would be all old people that got autoimmune diseases, and that's not true. And she also said that it's because we can recognize them, we can clinically identify them better. That's complete BS. Where are all these people that are in nursing homes that are chronically ill and have been for a long time? No, autoimmune disease will kill you and at a young age, not when you're in a nursing home. So those two things are not right. She said they're more prevalent in women, most likely because of hormones, which is I totally agree with. Our hormone structure makes us more susceptible. Stress affects our hormones much more than it does men, and so that can create some disruption inside of your body. Let's see. She talks about our immune system, that it's very complex and it recognizes you as you, so that in autoimmune, it's a misdirected immune response. So there's a breakdown in the system, that it's a dysregulation. And she said, why is it dysregulating? Genetics, of course, is what she said, that there's a genetic component, which I don't disagree with, but there's no reason for autoimmune disease to be on the rise if that's why we have autoimmune disease, because of our genes. Also, genes are just a great way to blame somebody else for your problems. Well, it's my genes, I can't do anything about it. And you're not taking any responsibility for what you need to do to change your health. So there are a lot of things we can do. She also said environmental toxins, which is so true. The only one she mentioned was silica. Hello, there's like thousands and thousands and thousands of environmental toxins that could affect the way our bodies function. One of them being like Roundup and glyphosate that they put on plants that we eat every single day, right? Or if you're not eating organic. Drug reactions. So, she was like, this one's great because if you have symptoms, you just take away the drug and their problem goes away. Well, great, but you're the one that gave them the drug in the first place. So anyway, UV light, she said, was one. Infection and viruses, which is, hey, Dr. Patrick, how's it going? UV light was one. Infection and viruses, she said, which I totally agree with, but I'll talk about it in a minute. And then smoking. And so, she gives a lot of these environmental things, but later on when she talks about treatment, she does not talk about anything related to any of those things. All she talks about is determining your phenotype of what kind of autoimmune disease pathway you have and how that influences the treatment pathway that they take. So anyway, she also talked about autoimmune disease and cancer, which I thought was interesting, because she has it flipped. So her theory was that every day our body fights cancer cells, right? Every single day our body is fighting cancer cells. It's a normal process. It's called free radicals, oxidative stress, and our body gets rid of them so that we don't develop cancer. And this happens in everybody. We all have cancerous genes and predispositions and things like that. Some of them are triggered and sometimes they're not. So she says that every day our body is fighting off cancer, right? Which is true. So, but for some reason, our immune system stays in that cancer fighting loop. It doesn't stop. And it starts to dysregulate because they see a correlation that diagnosis for autoimmune disease and getting a cancer diagnosis is really close together. So she thinks it's because we're, her theory is that we're fighting cancer all the time and that we get stuck in this immune dysregulation loop, okay? Really, it's the opposite, right? We have something that we are doing to our bodies that is changing our genetic structure or our DNA or mitochondria. Vaccines are the best example of how that happens, and I'll talk about that in a minute. But we have that change going on inside of our body, and that triggers our bodies to develop this autoimmune disease. And once you get in that autoimmune disease process, then your immune system is being affected, which means you can't kill those cancer cells like you should anymore, right? And then on top of it, most medical treatments for autoimmune disease are suppressive immune drugs, immunosuppressive drugs like steroids. So they are suppressing the immune response, which, how are you going to fight cancer cells when your immune response is being suppressed? So she has it completely flipped, that autoimmune disease is what's going to lead you to cancer, not the other way around. And their treatment is part of that. And, you know, she made a comment about how they used to just suppress, and now they have specific pathways they can follow. But all the pathways that she mentioned were all immune suppression pathways. So, whatever. Anyway. So at the very end, she makes a comment that says, you know, many of the diseases, we don't know what's triggering it. Okay, this is big. She said, we don't know what's triggering it. They don't know what's driving that loop, that immune dysregulation loop, okay? Stop what you're doing and go call a Wellness Way doctor if you have an immune process, because that is exactly what we do, is that we do help you figure out what's triggering it, right? She used the word that we use, trigger, right? That is my job as a Wellness Way doctor, is to help find the trigger. So what is it that's going on inside of you? Is it, you know, do you have food allergies? Do you have latent viruses? Did you get vaccine injured? Do you have food allergies? Do you have heavy metals? Do you have infections going on? Like that is our job. That is our job, is to find the trigger. So I love that she said, we don't know what's triggering it, because their training and guidance doesn't lead them to that. That is why they are so clueless when it comes to autoimmune conditions, because they don't know how to find that trigger. That's not their job. Their job is to manage your disease process. She said, she even mentioned like talking about drugs and therapies that they use, and how, you know, nothing's going to take away the rheumatoid arthritis. She was a rheumatologist. Nothing's going to take it away. And nothing's going to like stop the progression of it, but it's going to help alter the pathway of the disease. Well, what the heck does that mean? What does that mean? Hey, Dr. Jeremy, how's it going? Like, I don't understand. Nobody knows the cause or the cure, just manage the symptoms. Exactly. So it's just funny to me that, you know, these are some really smart people. Like, they are very intelligent, smart people. They're in research and clinical research trials, and they study mice and like all these things, and they are super smart people, but they have no clue. They have no clue. And I feel like it's sitting right in front of them. Like, she even mentioned it in the video. She talked about it's toxins, it's smoking, it's environmental, yet her treatment has nothing to do with that, which doesn't make any sense to me. So if you have an autoimmune condition, you need to find a Wellness Way doctor, because all they're going to do is manage your symptoms. That's all they're going to do. That's all they are capable of. She said it. She said it in her video. We don't know what's triggering it. We can't take the rheumatoid arthritis away. We can't even stop the disease process. All we can do is like manage your symptoms. She said it in her video. And this is a smart lady that's a leader, an educator. This was from like Johns Hopkins or something. And so if that's what she's saying, imagine what your, you know, PCP down the street or rheumatologist down the street is saying. So they don't know how to find the trigger. All they're going to do is give you a drug. That drug is going to lead to maybe managing your symptoms a little bit, but it's also going to make you more prone to cancer if it is an immune suppressing drug. Your autoimmune condition, they're right. It won't go away because they don't know how to find the trigger. We see patients in the Wellness Way all the time where I was trying to dig and find labs and I've lost them, but where, you know, patients present with Hashimoto's and they have autoantibodies for their thyroid. I can't tell you how many women I see that have thyroid conditions, and they come in and we test them properly and we see that they have antibodies. They have no idea. They have no idea. I know, it does. It makes me like mad. It makes me really mad that they're so ignorant to this. But anyway, and then those antibody levels, once we start treating them, they go down. They go down. Your ND will tell you that that cannot happen, that those antibodies will always be there.